Welcome to this clinical explainer from our expert orthopedic team at Westminster Multispecialty Clinic in Dubai Healthcare City. Today, we're uncovering the biological realities of cartilage and joint wear. You know, most tissues in your body have this highly reliable instant feedback system. If you damage a muscle, it tells you right away. Strain a ligament, the pain signal is pretty much impossible to miss. But cartilage is completely different. It's a silent structure. It can actually wear away for months or even years before you feel a single thing. By the time a patient walks into our clinic with joint pain, the damage is rarely new. So today, we're going to break down exactly what this vital tissue is, what threatens it, and most importantly, what we can actually do about it. Here is our agenda for today. 1. The silent joint structure. 2. How cartilage breaks down. 3. At-risk joints in Dubai. 4. Modern clinical treatment options. And 5. Warning signs to watch for. Let's get started.
Section 1. The silent joint structure. Understanding your body's biological shock absorber. Let's dive right in and establish exactly what we're dealing with when we talk about your joints. At Westminster Multispecialty Clinic, we always start by explaining to patients that articular cartilage is just a truly brilliant biological structure. It's this smooth, white tissue covering the ends of the bones inside your joints, and its entire job is to allow those bones to glide against each other completely without friction, all while distributing massive force loads. Just think about a healthy knee for a second. It can absorb and redistribute forces that are several times your own body weight when you run or jump, and it does all of that without your bones ever making direct contact. But here is the catch, and honestly the reason it's so vulnerable. It doesn't have its own nerve supply. Because it lacks nerves, it can literally wear away over a long period of time before you ever feel it. And this quote brilliantly illustrates the core structural issue we're up against. Cartilage does not heal the way a cut on your skin heals. Unlike most tissues in your body, cartilage has no direct blood supply. If you get a cut on your arm, blood flow immediately rushes to the site, delivering the cells needed to repair the tissue. Cartilage just can't do that. Instead, it relies on an incredibly slow, limited process of nutrient diffusion from the synovial fluid that surrounds it. This means it fundamentally lacks the body's normal, rapid repair response. Once it's damaged, it really struggles to fix itself. Section 2. How cartilage breaks down, the mechanisms of joint damage. So how does this biological limitation play out in real life? What we see with patients in our clinic is that cartilage damage generally happens through two broad mechanisms, and they are definitely not mutually exclusive. First, you have acute injury. This is a direct blow to the joint, a sudden twisting force, or a significant sports injury that physically shears or fractures the cartilage. This creates what we call a focal defect, which is essentially a specific pothole of damage in an otherwise healthy joint. Because of that lack of nerves we talked about, these acute injuries often go completely undetected until we happen to do an MRI for something else. Then, on the other side, we have gradual wear. This happens when cartilage is subjected to abnormal loading over time. It could be from structural issues like flat feet, a muscle imbalance, or just years and years of repetitive stress. This progressive breakdown is the main mechanism behind osteoarthritis. And here's the truly fascinating part. These two mechanisms often combine. A patient might have an old acute injury that created a small focal defect. Over time, that tiny defect alters how weight is distributed across the joint, which then dramatically accelerates the gradual wear and tear of the surrounding healthy cartilage. Section 3. At-risk joints in Dubai. Clinical realities for an active population. Now, what's really interesting is how these exact mechanisms impact our highly active patients right here in Dubai. Let's look at the specific joints that are most at risk. First up, the knee. It carries the absolute highest cartilage burden of any joint in the body. It's bearing your full body weight, operating through a massive range of motion, and constantly exposed to rotational and impact forces from almost every sport our Dubai residents play. At Westminster Multispecialty Clinic, our team frequently treats cartilage damage that is closely connected to ACL and meniscus injuries. You see, the meniscus acts as a secondary load distributor for the knee. So when a patient compromises their meniscus in a tennis match or a weekend football game, that protective cushioning is lost, and the cartilage wear accelerates rapidly. Then we have the hip, which is the second most commonly affected joint we treat. For our athletes who cycle heavily out on the Al Qudra trails or our marathon runners, they are loading that hip cartilage under significant repetitive force. The crucial point here is how this damage actually presents. Hip cartilage damage is incredibly common, but it's very often misdiagnosed by patients themselves. They'll come to us complaining of a deep growing ache or a dull discomfort, and they naturally assume it's just a stubborn muscle tightness or maybe a groin strain. It isn't until we use our clinical imaging expertise that we can clarify what is actually happening deep inside the joint surface.
We also definitely need to highlight the ankle because it is consistently underestimated. We see so many patients who suffered a severe ankle sprain, say 10 years ago. It felt fine eventually, so they just never properly rehabilitated it. What they didn't know is that the initial sprain caused a minor acute cartilage injury. Fast forward to middle age, and that old, forgotten sprain has silently evolved into a chronic osteochondral lesion. That's a complex area of cartilage and underlying bone damage that is now causing them persistent daily symptoms.
Section 4. Modern clinical treatment options. Beyond just living with the pain.
So, if cartilage doesn't heal like a normal cut and our active lifestyles put it at constant risk, what can we actually do? The most crucial point to take away today is understanding that you do not just have to live with these symptoms. The management of cartilage damage has evolved so dramatically over the last decade, it's no longer just a binary choice between suffering in silence or getting a full joint replacement. Our team's approach to this is a highly structured pathway. For early to moderate wear, step 1 is conservative therapy. This includes PRP, or platelet-rich plasma injections, which use growth factors from your own blood to support the joint environment and reduce inflammation. We also use targeted, image-guided injection therapies to deliver precise treatment exactly where that surface damage is. Now, if we are dealing with a distinct focal defect, step 2 is surgical intervention. We use highly precise arthroscopic procedures aimed at stimulating repair tissue or even transplanting healthy cartilage. But keep in mind, these procedures are vastly more effective when the surrounding cartilage is still largely intact, which is exactly why earlier intervention is so critical. Finally, step 3 is rehabilitation. And I want to be clear here, physiotherapy is not just a consolation prize if you avoid surgery, it's a primary treatment. Strengthening the quadriceps and hamstrings directly reduces the daily mechanical load that your joint cartilage actually has to bear.
Section 5. Warning signs to watch for. Listening to your surrounding joint structures. Because earlier intervention opens up so many more treatment options, let's talk about the warning signs you need to actively watch for in your daily life. Remember our core biological fact from the beginning: the cartilage itself will not send a pain signal. So you must pay close attention to the surrounding joint structures because they're the ones that will be complaining. Are you experiencing persistent swelling that predictably returns after physical activity? Do you have a deep ache that feels like it's deep inside the joint rather than just on the surface? What about crepitus? That grinding, crunching sensation when you bend your knee? Maybe your joint just feels unreliable, like it might give way slightly when you step on uneven ground. Or perhaps you experience significant stiffness after sitting for a long time, and it takes several minutes of movement just to loosen up. Now, none of these symptoms guarantee cartilage damage on their own, but collectively, if they persist for more than a few weeks, your surrounding structures are definitely telling you that the joint mechanics are failing.
We invite you to seriously reflect on this final question. Cartilage does not announce its gradual departure. Most people who have lost a significant amount of it had absolutely no idea until the entire joint began to fail. So the really useful question to ask yourself today isn't whether your joints are in agonizing pain right now. It's whether they've been sending these quieter signals, the swelling, the crunching, the unreliability that you just haven't acted on yet. If they are, please do not wait for the pain to become unbearable. Reach out to our expert orthopedic team at Westminster Multispecialty Clinic in Dubai, Healthcare City. Let us investigate those quiet signals with our advanced imaging and clinical expertise while your window for conservative treatment is still wide open. Thank you so much for joining us for this explainer, and we look forward to helping you keep your joints moving smoothly for years to come.